So you just had a knee replacement and you're wondering when can you drive? It's a really common question that many patients have. And today in this video, I'm going to tell you all of the information that I give to my patients about when and how they can return to driving. So stay tuned. Well, hello and welcome back. I'm Adam Rosen. Thanks for tuning in. If you have not already subscribed, please click the subscribe button so you get updates when new videos like this come out. And if you could, click the thumbs up like button so people like you that are looking for information like this can find the channel. So in today's video, I'm going to talk to you about how to know when it is safe to return to driving. It's a really common question that a lot of my patients have. And there's really no clear, simple answer. There was even a study that was done, I believe if I recall correctly, it was for an ankle fracture study. And the orthopedic surgeons had designed a pedal simulator in the office to try to determine when patients could safely go back to driving. But the problem is, it's not just strength and speed of going from pedal A to pedal B. It's a lot of reaction time, getting in and out of the car, strength, pain, mobility. So there's a lot of factors that play into that. The first thing that I always talk to my patients about is, do you have an automatic or a manual? And the question always is, which knee is it? So for many patients, if it's their right knee and they have an automatic car, we got to make sure that the knee is doing well enough to operate the vehicle. Whereas if you have an automatic and you had your left knee replaced, that as long as you're off narcotics and you can bend the knee to safely get in and out of the car, those patients can go back to driving a little bit quicker. So for automatic vehicles, left knee replacements, what I tell most patients is within 2 to 4 weeks. And for patients that have a right knee replacement and they have an automatic, we're looking more at 4 to 6 weeks. This is definitely longer if you have a manual because you now need to use both pedals and there might be a little bit more strength required and there could be more pain or discomfort if you have a clutch on a manual car. Now, simple things that I tell patients. Number one, you got to be off narcotics. You should not be operating a vehicle, and it'll say so on the bottle if you are on narcotics. Now, most of the time, because of these new multimodal pain protocols, many patients get off the narcotics pretty quickly, although they're still on other medications. But you should be off narcotics, kind of number one. Number two, you should be walking pretty well and independently. A cane would be okay, but if you're hobbling around and you're using a walker, you're probably not safe to operate a vehicle. And the other thing is you need enough range of motion to get in and out of the car, because if you can barely get in and then you drive a distance and you got to try to bend your knee to get out, you could get stuck. Or if you're trying to go shopping and then you're on your feet, you might have more pain and swelling and not be able to get back into your car. So range of motion is another important thing. The other thing is pain. That I always tell patients, like if a car stops short in front of you or a kid runs out in front of your car, you do not want to get into an accident. So if you're still having a lot of pain and you press down on that brake pedal and the pain stops you from applying full force, you could cause an accident, which could injure you, your car, or somebody else. So that's a really important thing. Now, the other thing that a lot of my patients run into is mom or dad had a knee replacement and son or daughter is there and they don't want mom or dad to drive because they're afraid that mom or dad's not ready. And there definitely becomes a family dynamic where kind of heads are butting. Mom and dad want their independence. They feel that they can. Son and daughter don't think that they're safe enough. And what I tell patients in that situation, and I don't know if this holds true in all states, but in the state of California, if you're a AAA member, they actually have a driving course type test that they will refer you to. And I'm sure in any area in the country, you could call a driving school and say, hey, could a driving instructor assess mom or dad, or me, if I'm concerned about whether or not I'm safe enough to drive the vehicle. And this way you have an independent, non-biased third party that gets in the car with you and makes sure that you're safe driving around and gives you the thumbs up of, yes, you're probably safe to drive, or thumbs down, you need to wait a couple more weeks. The other thing that you might consider is working with your therapist. Some therapists, although not driving instructors, will make sure that you can safely get in and out of the car safely and kind of assess whether or not you can operate the vehicle, especially with moving your feet and pushing on the pedals. So kind of a short video, but it's a common question that a lot of patients do have. So I hope this just gives you a little bit of information and an idea on how quickly you can return to driving and when it is safe and what options may be available to you if you're concerned, or if you're concerned about mom or dad driving the vehicle. So until next time, I'm Adam Rosen. Thanks for watching and stay safe.